I was looking at Reddit and I found this question from this person. I guess they must be getting ready to go to graduate school and get a master in public health. And they were asking, is a MPH from, which is better, a Yale MPH or a Brown University MPH? And I'm thinking, are they not looking at the news right now? Are you not looking at the news right now, my friend? What matters right now, should you still decide to get a MPH, is getting excellent internships. I have posted so many internship opportunities for people while they're still in college. You can go back and look at some of my posts on LinkedIn. Really, I posted it on YouTube community also. And I don't want to rain on anyone's parade, but I would also say be very flexible in your job searches. Don't only look at local, state, and federal public health jobs. You need to expand it. Maybe go to some other organizations that deal with public health. You might want to look at I will give you some examples. American Heart Association, American Lung Association. Look at some children's hospitals to see if they have any internships that intersect with public health. I've seen them at some of the other hospitals where they're having an internship. Those are just a couple. And you want to get somewhere where you're going to already be in the system. And if you're open to some other terminal degrees to go along with the Master in Public Health, yeah, but if you're going to do public health, those certifications are going to be very important, and networking. My son was talking to my daughter who works in film. Hey girl, hey my baby girl. Anyway, he was saying the best thing to think about in film, and I know that this is off topic, is phone numbers and money numbers. Really, emphasis on the phone numbers. The money numbers are important. I mean, we all have to live, but the phone numbers, meaning who are your contacts and mentors. And if you have a good working relationship with your professor, that's a good place to start. Hey, I'm looking for an internship. And to be honest, you might have to think of other ways of income. And I went to a for-profit school for public health. I knew that I could complete. I decided to do public health because I was looking at the courses and I'm like, these are things that I learned a lot as a public health nurse. So I said, I'm very likely to complete this. And I'm like, okay, let me go ahead and do this. And when I was working K through 12, in spite of that job being incredibly toxic towards the end, one thing they had was they would reward you for education. And I would say that getting that master's degree is what helped me to be really, really close to being at a six-figure income right before I retired. I'm pretty sure if I would have stayed there at least another 1 or 2 years, I would have been at a six-figure income just from even from the bonuses or whatever adding up. But anywho, when I got the public health contract job, it was right before all the things started happening with the public health cuts, and I put in an application for this job. I think that they were trying to just get somebody to be there until the component I'm working for, the funding was cut off. So, but what really helped me was when I did the interviews, I recognized a lot of people's names and they recognized my name. And the other thing was, one of the people that mentored me was at this particular health department. And guess who I got the name from of this mentor? When I first started at the K through 12 job, there was this nursing supervisor. And she's the one that gave me the name. Not the one towards the end that promoted. The first one there is the one that gave me the name. She got a sticky note and wrote the man's name on a piece of paper. Thank you. Thank you. I appreciate you. That was the original nursing supervisor I had on the K through 12 job before she retired. And the mentor had helped a lot of other students that were getting their public health. He brought me on, let me work on some, in this work group that dealt with like refugee health. So I had a lot of learning experiences.